Imagine a killer so covert that it could inflict untold damage without you even realising what it was doing. A killer who would leave no gaping blood-filled wounds, no bone-crunching pain, and no blood-curdling screams in its wake, but whose mark would have far-reaching consequences. Consequences that could see you becoming completely unrecognisable from the person you are today. No, this isn't the opening of the latest Stephen King thriller. This is high blood pressure. And in this video during May Measurement Month, I'll be telling you about how you can defend against one of the world's biggest killers. For the very best tips on health and wellness, subscribe to my channel and hit the bell to be notified whenever I upload a new video. And if you want to learn how to improve a range of symptoms and conditions using evidence-based lifestyle medicine that works, alongside a support system and accountability system that works for you, then check out thethrivepractice.com. Hi, I'm Leah, the scientist and health improvement specialist behind the Thrive Practice, where I do the detective work necessary to get to the root cause of my clients' symptoms and illnesses so that they can finally start to feel like themselves again. This channel is all about giving you evidence-based wellness advice that inspires and empowers you to hack your way to better health. Blood pressure is a measure of the amount of strain that your blood vessels are under at any given time. It's never consistently constant, but in order for you to remain the wonderful human that you are, it needs to be at a relatively even level. Too low and you're likely to feel dizzy and may even pass out. And too high and you may cause some serious damage to your blood vessels. Okay, here comes the science bit. Concentrate. For your body to get all of the goodies carried in the 4.5 litres of blood that repeatedly travel around your body, it needs a little push. And with each push or pump, blood will exert a force against the muscular walls of your blood vessels. This is blood pressure. The highest pressure happens when the ventricles at the bottom of your heart contract and push blood up and out of the heart and into the arteries. This is known as systole and is peak pressure. When the ventricles relax to receive the next batch of blood, blood pressure is at its lowest. This is known as diastole. When you measure blood pressure, we get two readings. The first is the systolic blood pressure reading. This is the bigger number, and in a typical healthy human, this ranges between 90 and 120 millimeters of mercury. The second or lower number refers to the diastolic blood pressure reading, and in a typical human who's healthy ranges between 60 and 80 millimeters of mercury. When we combine this, we expect the normal healthy reading for blood pressure to be 120/80. So how do you measure your blood pressure accurately at home? To get started, you'll need a blood pressure measuring device. These usually start at around £25, a table, a chair, and you. So a couple of points before you get started. Try not to drink any caffeinated drinks or smoke at least 30 minutes before your blood pressure reading, because this will affect the reading that you get. And also, ideally, you want to make sure that you take two readings 1 minute apart from each other, both in the morning and in the evening. Ensure that you're sitting comfortably with both feet flat on the floor. Your back and your arms should be supported, and keep your arm level with your heart. Put the blood pressure cuff on your bare arm and fasten the Velcro tab. Then rest quietly for 5 minutes, press the start button and wait for your reading to appear. Take a note of the systolic and the diastolic reading, especially if this isn't going to be transferred into your phone or other mobile device. Then wait 1 minute and repeat another blood pressure reading. And that's it. That's exactly how you accurately measure your blood pressure. Your blood pressure will vary throughout the day, but if it regularly rises above or stays around 140/90 millimeters of mercury, then we call that hypertension or high blood pressure. High blood pressure or hypertension could cause serious damage, putting you at risk of a heart attack or a stroke. That's why it's important for you to be intimately acquainted with your numbers. In the same way that you would know and remember your friends or family members' phone numbers, you need to know your blood pressure numbers that way too. Because oftentimes the first time people realise that they have high blood pressure is when they've suffered a heart attack or a stroke. So you have your numbers, now what? Well, the National Institute of Health and Care Excellence, which provides national guidance to the health service, says that your blood pressure is considered to be high if your clinic blood pressure is 140/90 millimeters of mercury or above, and your average home blood pressure reading is 135/85 millimeters of mercury or above. Great, so now you know the thresholds for high blood pressure. What about treatment? The European Society for Hypertension and the European Society for Cardiology recommend that treatment for blood pressure be based on your blood pressure readings and whether you have known cardiovascular risk factors or specific disease. What are cardiovascular risk factors? Well, these include things like raised blood cholesterol, raised triglycerides with low HDL cholesterol, diabetes, smoking, being overweight or obese, being inactive, excess alcohol intake, and experiencing excessive stress. There are also risk factors that cannot be changed, things like your gender or family history. So this chart clearly describes what treatment should be used through each of the categories of blood pressure. If you're in what's described as the high normal range, that's a systolic reading of between 130 and 139 millimeters of mercury, or diastolic reading of between 85 and 89 millimeters of mercury with no other risk factors, no specific treatment is recommended. However, if you have one of the known risk factors, damage to your organs, or you have a cardiovascular disease, then the recommended treatment is lifestyle changes. If you have what's known as stage 1 hypertension with a systolic reading of between 140 and 159 millimeters of mercury, or a diastolic reading of between 90 and 99 millimeters of mercury without any risk factors, then your doctor may ask you to try making lifestyle changes for several months before putting you on medication to lower your blood pressure to less than 140/90. If you have risk factors, you'll be asked to try lifestyle changes for several weeks before being put onto blood pressure lowering medication. Whilst at the more serious end, for those with organ damage or other conditions or cardiovascular disease, lifestyle changes will be encouraged, but medication will be given more quickly. With a systolic pressure between 160 and 179 millimeters of mercury and a diastolic pressure of between 100 and 109 millimeters of mercury, you'll be in what's known as stage 2 hypertension. If you have none or minimal amount of risk factors, you'll be encouraged to try and make lifestyle changes for several weeks before your doctor reassesses you and gives you blood pressure medication. With a higher number of risk factors, organ damage or disease, blood pressure lowering medications will complement lifestyle changes to help speed up the process of you lowering your blood pressure. Severe hypertension is a systolic pressure of 180 millimeters of mercury or above, and a diastolic pressure of 110 millimeters of mercury or more. This is dangerously high blood pressure, and whether you have risk factors or other health conditions, organ damage or not, the treatment recommendations are the same. Lifestyle changes with immediate blood pressure lowering medication in order to reduce pressure to less than 140/90 millimeters of mercury. Now, I'm sure it didn't escape your attention that for all types of blood pressure readings, lifestyle modification is the cornerstone of treatment, and in many cases, the first line of defense. But lifestyle changes isn't very descriptive, so in the next video, I'll be covering ways in which you can help lower your blood pressure through diet and lifestyle. So there you have it. Now you know exactly how to measure your blood pressure accurately at home and exactly what those blood pressure readings mean. Don't forget to check out these videos on how to hack your way to better health. And if you like this video, hit the like button, subscribe and share it with someone who could benefit. Thanks for watching, and I will see you on the next one.